Here's another example. When we went into, this is another district in Papua New Guinea, when we went in there were 26 tribes warring with each other. They had been fighting with each other for 16 years. No child had been educated in this district. When our community health team went in to do community health evangelism, they immediately realized, unless we stop the war, there's not going to be any progress. So that's what the issue becomes. And so I came back a year later, and I was standing out in an open field. The different tribes that had been warring, the different clans that had been warring, were all in an open field out in front of us. There were two chiefs. The one standing next to me, I'm the guy in the blue on the left. The village chief there held up the bow and arrows, and he said to me, "I want to thank you because you've come here. Our forefathers taught us to use this bow and these arrows." And then he took one out. He said, "This is the kind we use to kill pigs." He put it back in his other hand. He took another one out and he said, "This is the kind we use to kill each other." Then he put it all together and he handed it to me and he said, "I want to give this to you because you've come here and you've taught us a different way of life. You've taught us to live at peace with one another." So backing up to see this slide, what this slide is a footpath between two clans that had previously been fighting. They built the footpath, they walked down to the bottom and built the retaining walls, they decorated the footpath. Nobody in my Bible college or seminary education ever told me that a footpath would be an indicator of spiritual growth. But because we've separated the physical from the spiritual, that's where we end up. So the title that I started with today is Community Health as a Framework for Global Mission. And what we're seeing is that when we minister to them word and deed, we're able to disciple them out of their animism and disciple them in ways that we can't do unless we put word and deed together. Let me stop here and talk about my own personal experience. I went to the mission field as a church planter. I was taught by my colleagues when I arrived, if you feed somebody today, they're going to be hungry again tomorrow. If you save their soul today, they're saved forever. And that's what I believed. So in my mission organization, I was the real missionary. I was a church planter. And the medical people, they were support personnel. They were only there to help me out because I needed somebody to draw a crowd and somebody to, but I was the real missionary. I had to repent of all of that. And the way it happened was I was working with some men that I'd led to the Lord that were going to become the elders of the church, and I asked them what the mission of the church was, and they said it was loving God and loving your neighbor. I said, no, it's evangelism. They said, no, it's loving God, loving your neighbor. I went back to the scriptures and I saw the prophets screaming about injustice, and I saw Jesus saying, if you've done it to the least of them, you've done it to me, and putting himself in the place of the poor and the sick and the prisoner. And I realized the same Jesus who asked me to preach the forgiveness of sins commanded me to take care of the poor. And that I was choosing which of Christ's commands was most important rather than finding a way to do everything Christ commanded. And the problem is going to be balance. The problem is going to be staying in the radical middle where Jesus was. My father's generation fought the social gospel, and they emphasized evangelism. My son's generation is fighting evangelism and putting forward social justice. If we want to be like Jesus, our ministries have to be combined. We have to be in the radical middle. And this is an illustration of why that is. Second shift is from needs-based to asset-based development. We need people to be subjects rather than objects of healthcare. And this is the perspective we go in with. We see the people we serve as made in the image of God, stewards of resources rather than victims of circumstance. And we don't ask them, what do you need? We focus on their assets first, help them understand the causes, why they have some of the problems they have, focus on their assets and allow them to create solutions. That's community engagement, and that's what creates not only the opportunity to change a village, but to see our work sweep a countryside.